Hey everyone, Dr. Ackerman here, chiropractor with Active Chiropractic Care, and we're going to be going over some of the most important exercises that are essential for proper hip, knee, and ankle function. So the first exercise, I'm sure you all know of it, is a bodyweight squat. And the reason why a bodyweight squat is such an important exercise is because it's a compound movement, meaning that it's using all of the joints in your lower body at the same time. So what you're going to do is you're going to keep your feet shoulder width apart, you're going to keep your shoulders back and down, and you're going to also make sure that you keep your chin tucked in, and then you're going to shift your weight back onto your heels and bring your arms out in front of you for balance. And you're going to slowly lower yourself down like so, and then you're going to bring yourself up like so. So you're going to lower yourself down, and you're going to bring yourself up. So from the side, it looks like so. Notice how I'm squeezing my glutes at the top, each time getting full extension and focusing on the form and the right function. So that's a bodyweight squat. And now after you've mastered that, you can bring your legs further apart, which is what a sumo squat is for. Sumo squats are really good because they work more of the vastus medialis, which is that inner quadricep muscle. They work more of the adductor muscles, which are the inner thigh muscles, and they also work the glute max a little bit more because your legs are wider apart. So for a sumo squat, I like to bring my hands into the center, and so we're going to go all the way down, get down to the floor, and we're going to come up and again squeeze those glutes at the top. So we're going to go all the way down, keeping my knees wide apart, and we're going to come up squeezing those glutes at the top. So most importantly is that you're not leaning forward. A lot of times people will lean forward, which is not a proper squat, and that usually means that you have poor hip mobility. So you want to keep your chin tucked in, shoulders back and down, and you're going to squat straight up and down. So that is the sumo squat with your body weight only. Then we have lateral lunges, and lateral lunges are vital because they move your body in the different planes of motion. Most of our life we move front to back, down and up. So a really important exercise for your lower body, hips, knees and ankles is lateral movement, because this is where most injuries occur because most people don't train from side to side. So to do a lateral lunge, you're going to keep your feet wider than shoulder width apart, just like you had with the sumo squats, and you're going to shift your weight back again, and you're going to stretch one leg as you go down to the other leg, doing a lateral lunge. Notice how my hands come forward again for balance. This is really important to help keep my balance. And then going the other way, we're going to lower like so. So this is a really good exercise for the ankles, for the knees, the hips, and to work laterally from side to side. Then we have back lunges, alternating legs. Now a back lunge is really good for the knees because it puts less pressure on the knees than a front lunge or a walking lunge. So to do a back lunge, you're going to step back and you're going to lower yourself down and you're going to come back up. So you're going to step back and come back up. If you want to make it more difficult, you can step back and drive up and balance in between each repetition. This is a really good way to engage those balancing, stabilizing muscles of the hips and the core. And then you want to alternate. So you're going to go from one leg to the other leg, like so. So this is an alternating back lunge. Notice what I'm doing with my hands, how my hands are alternating as well. So it's just like I'm running in place, and this way we're training the muscles to fire together. So in the future, if you decide that you want to run, your muscles will already be trained and conditioned for those movements. Another exercise for your knee is the vastus medialis activation, and it's a really important exercise because the vastus medialis is this inner part of your quadricep muscle. This muscle is extremely important in protecting the kneecap and also making sure that your kneecap tracks up and down in its groove to prevent any kind of knee pain or knee problems. So the first thing you want to do when you're doing vastus medialis activation exercises is you want to take your leg and turn your toes out about 15 degrees. And what that does is it's going to allow you to activate and focus on the inner muscle of your knee, which is the vastus medialis. And we're going to go and flex and extend the knee, holding it at the top, and you're going to squeeze this muscle here so that you can feel that muscle activating. So the whole idea is to hold with your hand and feel that muscle activating under your hand. That is the vastus medialis activation exercise, and of course, you're going to want to do it on both legs. So then again, you're going to take your leg, turn it out 15 degrees, hold that inner quadricep muscle so that you can feel it activating at the top of the movement, and make sure that you squeeze it and hold it so you can feel the muscle that you're trying to activate. So that is the vastus medialis activation exercise. Next, I'm going to show you some side lying exercises to work both the glute medius and the inner adductor muscles. So for that, we're going to have you laying on your side, like so, and we're going to do glute medius first. So for glute medius, you're going to bring the top leg out in front of your bottom leg, and you're going to raise it up, and you're going to feel the outer glute activate at the top. So we're going to raise that leg and hold it at the top, like so. This is for glute medius activation. Now, for the glute medius, you definitely want to feel it on the outside of your hip here, and that's how you know you're doing it properly. Then we have the adductor muscles, which are basically the muscles on the inner leg on the bottom side of the table. And to work those muscles, you're going to cross the top leg over, and you're going to lift and lower that inner leg. If you're doing it properly, you're going to feel it in your inner thigh muscles on the leg that's down on the ground. So that is the adductor exercise for the left leg, and then this would be known as an abductor exercise for your right leg. And of course, you're going to do those on both sides, and then after you do them on both sides, we're going to go to a straight leg raise, which is exactly what it sounds. You're going to keep your leg straight, raise it to 45 degrees, and then lower it back down slowly. So raise your leg, keep it straight, 45 degrees, and lower it back down slowly. And then you're going to go ahead and do it on the other side as well, raising that leg 45 degrees and lowering it slowly. And what this is doing is it's strengthening a muscle called the rectus femoris, which is a hip flexor muscle, and it's also a really important muscle for the hip, knees, and ankles. So make sure you do these exercises on both sides. Make sure you do about 10 to 15 repetitions because you want to strengthen your muscular endurance. And these exercises are great to do for your hips and your knees. Next we have calf raises. Now calf raises, what you're going to want to do is get yourself a stair or a step, something that you can step on that gives you enough clearance so that your heel can go all the way down and get a good stretch into your calf. There's two exercises I'm going to be showing you. One is for the gastrocnemius, which is the bigger calf muscle, and the other is for the soleus, which is the smaller calf muscle, lower down by the Achilles tendon, closer to your heel. So what you're going to do is you're going to step on, and for the gastrocnemius, you're going to keep your legs almost completely straight, and you're going to lower yourself all the way down, getting a good stretch into your calves, and then you're going to raise all the way up onto your tippy toes, pausing and squeezing at the top. So you're going to lower yourself all the way down and come on all the way up and squeeze at the top. Now if you want to challenge yourself even more, you can go to one leg at a time, and you can focus on doing one leg at a time. Now for the soleus muscle. For the soleus, you're going to add a slight bend into your knees and focus on keeping your knees bent as you raise up and as you come down. And what that does is it allows you to get deeper in to the soleus and the lower down muscles of the calf. That's going to strengthen the ankle and the Achilles tendon area. So it's important that you do both variations of the calf exercise. Lastly, we have what's called duck walks. Now they look relatively funny, but if you think about it, we have two ways of strengthening the back of the calf, but we need a way to strengthen the front of the calf, which is also known as the tibialis anterior muscle. So one of the ways that you can do this is by walking on your heels, which is also known as duck walking. So what you're going to do is you're going to get onto your heels and you're going to focus on taking steps both forward and backwards only on your heels. And what that's going to do is it's going to help strengthen and build up the muscles in the front of your shins to prevent shin pain, shin splints, and also to prevent imbalances from the front to the back of your calves. So I hope these exercises help you with your hips, knees, and ankles. They're definitely something that you want to perform on a regular basis so that you get better at doing them and stronger at doing them. And if you have any questions, make sure that you contact us, whether you reach down into the comments below or you give us a call here at the office. Either way, we'd love to help you. And most importantly, remember to stay healthy and stay active.